Medicare Advantage or Original Medicare, which one is best for you? Hello, I'm Thomas Smith, founder and lead healthcare agent of It's That Time. When we get a wedding invitation, we are often asked to pick between two choices, chicken or steak. But if we wish that we had picked the other choice, it's no big deal. The bride still looks great, we still have all of our dance moves, and it's only a meal. On the other hand, Medicare Advantage or Original Medicare is not chicken or steak. Our future health, the medical issues that we could have now, could have next week, or most likely will have in the future, and how we deal with them is at stake. Medicare rules for healthcare agents do not allow me to discuss the extra benefits of Medicare Advantage plans in this format, but for most people, Medicare Advantage plans will often come with extra benefits that Original Medicare does not have. Medicare Advantage will usually cost you less in premiums and total amounts spent, although with Medicare Advantage you will have co-payments, which with hospital stays and cancer treatments especially can get costly. However, you are protected with a maximum out-of-pocket amount, we agents call it MOOP, after which you have no further co-payments. So you do know your downside. Medicare Advantage plans, which can be HMOs or PPOs, work beautifully for a lot of people. Many people will tell you they saved a lot of money by going with Medicare Advantage. That said, the most common question I get, in fact, I have been asked it hundreds of times, is, which one am I on myself? My own choice and my reasons for it may be very different than how others weigh it. But I am on Original Medicare with a Medigap Supplement. It costs me more each year than Medicare Advantage would, and I don't mind. The car I choose to drive also costs me more than a more economical choice would, so not all of my choices are about the best value. There are two reasons I chose Original Medicare with a Plan G Supplement. Firstly, I can see any doctor or go to any clinic or hospital in the USA that takes Medicare. Maybe if I get some exotic disease, I will want to travel to a hospital somewhere else that specializes in my disease. Chances are I won't. But my point is, I don't want to be told that I can't. The majority of doctors and hospitals take a large percentage of Medicare Advantage plans, but there are some doctors and clinics that only take Original Medicare, and I don't want to be restricted. With Original Medicare, I can do my own homework and make my own appointments with specialists with less concern as to whether they are in network. Because with Original Medicare, there are no doctor networks, if they do take Medicare at all, then I can see them. The second important reason for my own choice of Original Medicare is that Medicare Advantage plans often require pre-authorizations. Medicare Advantage carriers want to pre-approve before paying out a lot of money on expensive medical procedures. Original Medicare is not a ticket to anything medical you want, but to the degree that there are any authorizations needed or may be required by rule changes in the future, these restrictions are much fewer. The choice often comes down to less cost on one hand versus more freedom and flexibility on the other hand. I can't tell you which should be more important to you. My own clients choose between the two options right around 50-50. My recommendation is to think of Medicare and the coverage that you will want based upon someday. Today you may be 100% healthy or close to it, but that can change at any moment. If you were to have some major medical issue where you could not switch to original Medicare with a Medigap supplement, would you be happy with Medicare Advantage, or would you want the extra freedom and flexibility of original Medicare? If the answer is original Medicare, my advice is to not play chicken with possibilities, even if it saves you money to do so now.